It's the new health secretary there. So is he right? Is it time to change how we think about coronavirus? We're joined now by Dr. Zubaida Haque, a member of Independent SAGE, a group of scientists offering independent advice to the government, and also by Professor Heneghan, director of the Centre for Evidence-Based Medicine. Thank you both for being with us. Dr. Haque, first of all, this, sort of big bang lifting of restrictions on July the 19th, does this make sense to you?
No, absolutely not. And I think it's going to be terrifying for approximately half of the population who are either partially vaccinated or not vaccinated at all. And that includes children who are still in school and who have enormous educational disruption. So no, given where we are with the Delta variant, we're given how transmissible it is, given the fact that we have 27,000 cases a day, which compared to the beginning of May, where it was less than 2,000 a day, it is phenomenal that a government who just 2 weeks ago postponed the June 21st date because of how high the cases are, because of what that meant in terms of dangers for the population, that just 2 weeks later they're saying, look, we're going to go ahead and we're going to abandon all COVID safety measures.
Right. And Professor Heneghan, I mean, is it really a good idea to lift all the restrictions in one go? I mean, it is still, I guess, the government's job to limit the risk to everyone.
Well, look, I think there is an important point. There is a difference between some people who are feeling highly anxious as we go forward. And that's been for months now with the messaging that's come to many people who haven't been out there in society. But for a proportion of society, they're out there at the moment and want to get on with it. When you look at the data, we haven't just completely opening up. We've already opened up quite a bit sections of society. Where we haven't is if you look at the Google data, is workplaces. They're down by about 40%. Public transport, but retail is starting and recreation has started to open up. At some point, you've got to agree with the government policy that it's about context. Looking at the wider issues of all the healthcare issues that go on, and particularly all of the acute respiratory pathogens that we face daily. As a general practitioner who's worked in urgent care throughout the whole of this pandemic, there is still influenza out there, still RSV, lots of different pathogens. So if we had some context, people might be able to feel a bit more reassured. Right now, it's as safe as it's ever been. And I'll tell you why. If you look at the ONS data today on deaths, there's over 700 fewer deaths than what we'd expect in this week. So it's important to put the data into the context, wider context of all healthcare.
Right. So, Dr. Haque, it's as safe as it's ever been. And cases are rising clearly, but the link does seem to have been weakened between cases and hospitalisation and certainly cases and deaths.
Let's focus on a couple of things. First of all, it's really important to focus on the fact that cases are extremely high. Now, what does that mean? That means that we've got lots of people right now who are unprotected. Only half of the population have been vaccinated fully. We've got 17% partially vaccinated and the remaining over a third who are not vaccinated at all. So no, Carl, it's not the right time to be opening up. When we should be fully opening up, the time when we should be getting rid of all measures is when the whole population is protected. And you talk about the vulnerable. What about all the vulnerable children? What about the children that have diabetes, that have asthma, that are recovering from cancer? What about all those children that are currently unprotected? What about the over 600,000 children who at the end of last week missed school because of the high rates of COVID? And what about the fact that we all know that the more cases that you have, the more vaccine resistant, the more likelihood of vaccine resistant mutations you can get?
So, Heneghan, so what about the vulnerable children? And also, long COVID is a serious issue with, some stats say 1 million, others say 2 million people suffering from it already.
So there are two issues within children. Number one is they are disproportionately affected by some acute respiratory pathogens, particularly influenza, as I've said, RSV, many of the ones that we vaccinate against. But actually with COVID, we know that the mortality is incredibly low. And actually you can pick out those who are vulnerable, but they're vulnerable to all of the pathogens that exist. So I think again, I'm going to say, yes, again, the context matters. And it is important. The two important aspects, I think, what we look to are, one is, how do you advise people to protect themselves when cases are rising? Well, actually, the best way to do that is through socially distancing. You can have a choice over the next few weeks. And I think that's important. And that's what the health secretary said. There is a choice about what you make next. The second issue...
But sorry to interrupt, but can you really have a choice if other people are not social distancing and other people decide they're not going to wear a mask on the tube and various things? I mean, can you do you lose your own personal choice by other people exercising theirs?
So I think what you're referring is to specific areas, like certain areas like the tube, where you have concerns about in very enclosed spaces. Now, look, this is an important aspect. When we disagree about the evidence base, and this is 25 years of experience, it happens because there's a dearth of evidence to inform the policy. We are relying on low quality evidence to understand interventions. What we should do when we're in this situation and the morbidity and mortality is low is start to investigate and reduce the uncertainty about what exactly works. Because there's no doubt if you let the public know and can quantify their benefits, they'll make good choices. But at the moment, there's still lots of uncertainty about what affects transmission and what actually works.
Right. So, Dr. Haque, I mean, is this a matter for individual responsibility and judgment? Are we at that stage?
How can children enact individual responsibility in a classroom where there are 30 other children, where there is very little ventilation, where there are no face masks required, where the government have done absolutely nothing really to protect them in terms of COVID safe measures? There's nothing there. So talking about personal responsibility, I mean, where is the personal responsibility there for children? How can they take that personal responsibility? And it's not fair. It is not fair to say to the public, listen, this is up to you now, and here's the personal responsibility, when you've created a situation where they have very little choice, because when they go on the tube, it will be full of, I mean, with high rates of COVID, there will be COVID everywhere. There is very little choice. And let's not forget, Carl, all the vulnerable people, all the people with underlying issues, with immunocompromised issues, with, you know, where the vaccine hasn't really helped them because of their illnesses. They don't have a choice at all.
All right,
we shouldn't be just talking.
No, and so let's just put this point finally to Carl Heneghan. You could have, Carl, you know, the kind of unlocking that you want, this kind of reopening of society, but with people wearing masks in certain circumstances that you remember, that you mentioned, public transport and so forth. Why do we have to stop the enforcement of people wearing masks?
Look, one of the key things about what you're describing is developing an evidence base to inform what works and what doesn't. We get that with issues like dexamethasone and drugs. We get that with vaccines. We want to know whether they're effective, which they are highly effective, and are they safe? When it comes to these interventions, you certainly want to know in what situations do they work. To answer that, you need an evidence-based approach that does trials. And in doing that, we'll reduce the uncertainty and we'll reduce the disagreement. And high quality evidence will allow us to operate in a same direction and inform the public what to do. If we don't do that, we will end up in these disagreements forever. And people will throw different policies at you, as we've seen almost weekly.
All right, 10 seconds, Zubaida.
Carl, We have lots of available evidence, and in a pandemic, we can't wait around for randomized controlled trials and longitudinal studies. We have to use the best available evidence, and there is really significant evidence that says face masks are a really important mitigation during the pandemic. That this is an airborne virus, and that really matters. So face masks shouldn't be abandoned, and social distancing shouldn't be.
That was 20 seconds. Zubaida Haque, thanks very much, and Heneghan, Professor Heneghan, appreciate your time. Thank you.
You're welcome.
Thank you.